Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Today's presenter is Dr. Vandana Sharma. Dr. Vandana Sharma completed her PhD in molecular biology and chemistry at the University of Chicago. She attended medical school at the University of Chicago Pritzker School of Medicine. Dr. Sharma completed her residency in internal medicine and her fellowship in medical oncology at Stanford University. She is board certified in medical oncology and internal medicine. Dr. Sharma is co-medical director for the Palliative Care Program.
Hello everybody, thanks for coming. I'm going to be talking today about early detection and prevention of female cancers. Sometimes I digress and I talk about some male cancers too, because some of these can be applicable to men. And we also know that women are often very involved with the care of their family and deciding what kind of treatments and preventative measures family members need to have. So I like to have a little bit of a global approach. But we're going to talk about a variety of cancers. And the first thing is to talk about why is this important? So obviously for those of you you're here and you're interested in learning about cancer, but cancer is a very common disease. So many people say to me, what's going on? It seems like everybody around me is getting cancer. What's happening? And it's actually the second leading cause of death in the US. Number one being heart disease. So heart disease and stroke is number one, cancer is number two. And we've made lots of progress in treating heart disease and preventing strokes and preventing heart attacks. And we're predicting that cancer will soon become the number one cause of death in the US. The American Cancer Society predicts about 1.6 million new cancer cases to be diagnosed, and this is data from 2012, but it's pretty much been in that same number, about over 1 million new cancer cases to be diagnosed. And about 38% of women and 44% of men will be diagnosed with cancer in their lifetime. All right, so you think about those numbers, so about 1 in 2 men and 1 in 3 women are going to get a diagnosis of cancer in their lifetime. Over 500,000 people will die from cancer each year, and this is just in the US. And the good news is that there's actually more cancer survivors than we've ever had in this country, and there's approximately 11.7 million cancer survivors, which is 1 in 20 adults. So very common disease, and it's pretty much touched everybody's life in some way or another. The disease is very complex. There's a lot of discussion about, oh, we're going to have a cure for cancer. And there was a lot of disappointment that we didn't get a cure for cancer after launching the war on cancer in the 70s. But the thing is that it's a very complicated disease. Cancer of the breast is very different than cancer of the lung, and it's very different than cancer of the liver. And it's not a single disease process because it involves interactions between the cancer cell as well as the blood supply, as well as the immune system. So we know that it's not just like having a broken bone, where you bring the two pieces of the bone together and it heals itself. There's a lot of complex biology and physiology in cancer. And it's also a disease of aging. So as we age, we are exposed to more mutations, more things that cause mutations in our cells. So we can see the incidence of cancer rising as people age. So one of the reasons why it seems like everybody in our friend group is getting cancer, it's usually because we're all getting older. So when people are in their 20s and 30s, there's different issues that are going on in life than when people are in their 40s, 50s, and 60s in terms of health issues and other medical problems. What is cancer? It's basically an issue of when a cancer cell, when a cell, which is a normal cell, undergoes a mutation. So a mutation happens to that cell's DNA, and that cell, because it divides into 2 daughter cells, passes that mutation on to those other 2 cells. And if the mutation is one that allows the cancer to grow, it allows the cancer cells to proliferate, it will cause a tumor to form. The other things that have to happen in order for cancer to form is that the tumor has to be able to evade growth suppressors. So your body has a natural mechanism that if something is growing out of control, other parts of your body will come in and stop that abnormal growth. But cancer has developed a way to subvert those growth suppressors. Cancer cells can also invade and metastasize. So what differentiates a benign tumor for a cancerous tumor is the ability of the cancer cells in a cancerous tumor to leave that organ where they started. So people can have benign tumors of the breast, for example, but those cancer cells or those tumor cells in the benign breast tumor cannot leave the breast. They're restricted to staying in the breast. I kind of use an analogy of if you imagine you had supervillains that were in this room and they had different supervillain powers. One supervillain may be able to, read somebody's mind, but that supervillain can't break through these walls. Whereas a different supervillain can actually punch through the wall and go and spread to different parts of the building. So that's what differentiates a benign tumor from a cancerous tumor, is the ability of those cancerous tumor cells to break away from the tissue where they started and spread to other parts of the body. There's an idea of replicative immortality. Cancer cells are immortal cells. Most cells in the body have a natural lifespan. After 3 days, after 3 months, after 5 years, those cells die, and they die in their natural process. Cancer cells can be immortal. They can live forever because they've gained mutations that allow them to essentially have immortality. Inducing angiogenesis, cancer cells can bring a blood supply to them. So your blood supply is the highway for your body. Once a cancer cell enters into the blood supply, that cancer cell can spread anywhere. It can spread from the breast to the liver or to the bone. So what the cancer cells do is they bring the blood supply to them, right? So it's imagine a situation where you've got a house out in a farm somewhere in some rural area, and there's no roads leading into that farm. It's very hard for those people to leave. Whereas if that farm can grow into a community and can bring in roads and highways, now all of those people have a way to get out and to spread to other parts of the world. And then cancer cells also resist cell death. So there's natural mechanisms in the body, particularly the immune system, which can cause a cell to die. They can either kill the cell or they can trigger processes in the cell so that the cell goes down a pathway of a suicide pathway. And what happens with cancer cells is they're resistant to the process of dying. So you can see how when all of these things happen in a cell or a tumor, it can become cancerous. So cancer death rates in 2015, the number one cause of death for both men and women is actually lung cancer. So you can see that lung cancer is number one. The number two cause of death for women after lung cancer is breast cancer. And then number three is colon cancer. Breast cancer, however, is the most common cancer diagnosed in women, and prostate cancer is the most common cancer diagnosed in men. The good things, I always like to pair one of my negative slides with a positive slide. So even though we see high rates of cancer, we also know that rates of death from cancer have actually been declining. And a lot of that has to do with the fact that we are detecting cancers at earlier stages. So we know stage for stage, if a person is diagnosed with stage 1 breast cancer, she's more likely to be alive and cancer-free in 10 years than if she's diagnosed with stage 3 breast cancer. So adding screening mammography, awareness, cancer prevention techniques have led to people being diagnosed with cancer at earlier and earlier stages. Also, our treatments have improved. So somebody who was diagnosed with cancer in the year 2000, if they were diagnosed with breast cancer, are more likely to survive than somebody who was diagnosed in 1960 because our treatments have improved. So the rate of death from cancer has decreased. The only one that we're seeing an increase in now stabilized is lung cancer, and this has a lot to do with smoking. So we saw more cases of lung cancer and more cases being found at a later age, and now that we've gotten a little bit better about smoking cessation and fewer people are smoking, we're seeing those cases and those numbers dropping off. This overall decline in cancer death has led to this prediction that for women, we've actually had almost 300,000 cancer deaths prevented since the war on cancer was launched in the 70s. So here's just some data about the lifetime probability for developing a specific cancer. For breast, for women, it's 1 in 8. So that's a pretty high number, and that's why it seems like when women are entering into their 50s and 60s, it seems like everybody's getting breast cancer because it's kind of common, and we're seeing higher rates in that age population. Uterus cancer, 1 in 41, ovary cancer, 1 in 71, and cervical cancer, 1 in 142 in the US, higher worldwide. Actually, cervical cancer is one of the highest, has the highest incidence worldwide. And this has to do with the fact that women get pap smears in the US where they don't get pap smears worldwide. So when they have abnormalities that are very early stages, they're getting treated and they're having preventative health care. Also now there's a vaccine to prevent cervical cancer. So we'll see this rate declining even further in the future as more young people, girls and boys, are being vaccinated against cervical cancer. And that same vaccine is actually preventative against other cancers for men, such as penile cancer and anal cancer for both men and women. Because the same virus that causes cervical cancer also can cause penile cancer, can cause anal cancer, and also implicated in head and neck cancers. So we don't screen for all cancers. We screen for a handful of cancers. And the reason that we don't screen for every cancer is complex. First of all, in order to have a good screening test, well, first of all, we need to have a good screening test. So not all cancers have great screening tests. Secondly, the cancer has to be common enough in the general population for us to be able to screen for that. So it doesn't make sense to screen for something that's really rare because we're not going to find that many cases. So the cancers that we screen for, cervical cancer we talked about with pap smears and HPV testing. So HPV, human papillomavirus, that's the virus that has been implicated as a causative agent in about 80% of cervical cancers. So we can screen for that with a pap smear. And that's the virus for which we now have a vaccine. So we can prevent people from being infected with that virus, and we can prevent them from developing cervical cancer. And it's also can show up with something like abnormal vaginal bleeding. So it's got a symptom that gets somebody's attention. So when a postmenopausal woman starts having vaginal bleeding, she's going to go to her doctor because she's noticing something is wrong. Skin cancer, we do screening for skin cancer regularly with physical exams. And we really recommend that individuals who've got a lot of moles and have had a lot of sun exposure have a regular physical exam once a year with their doctor or dermatologist to make sure that there aren't any skin cancer lesions. Breast, we have mammograms and MRIs, and also again the breast is an organ which is very readily accessible, so it's kind of easy to screen for it because there's a very easy test available. Prostate screening can happen with a blood test called the PSA and a digital rectal exam. Colon cancer, screening for that includes fecal occult blood testing, so testing for hidden blood in the stool, and then colonoscopy. And then there's another test that's available called Cologuard. Lung cancer was not a cancer that we used to screen for a while ago, but now we have good data that shows for certain people, so populations that are at high risk for lung cancer, which are individuals age 55 to age 75 who have a 30-pack-year history of tobacco use, so who've smoked 1 pack of cigarettes a day for at least 30 years, or they're a current smoker or they quit less than 15 years, they can get an annual CT scan. So they can have a CT scan of their chest to screen for lung cancer. So that's one of the newer cancers that we're starting to screen for. Cancer prevention, so doing the things that we know in life can decrease our exposure to carcinogens. So carcinogen is an agent that's in the environment which we know causes cancer. So tanning beds, and here is a cartoon which basically says get a lovely tan, but then pick your cancer of your skin that you want, your basal cell, squamous, or melanoma. In fact, the FDA has issued an alert against tanning beds for this specific reason. So we encourage everybody to not increase their skin cancer risk by avoiding tanning beds. Tobacco use. Tobacco, cigarettes are actually responsible for about 30% of all cancer-related deaths in the US, 90% of lung cancer deaths. Also implicated in cardiovascular disease and pulmonary disease, so heart attacks and emphysema. And everyone thinks about cigarette smoking and lung cancer, but that's not the only cancer that cigarettes are implicated in. Head and neck cancers are higher in individuals who smoke. Bladder cancer is higher in individuals who smoke. cancer of the esophagus, colon, anus, cervix, liver, kidney, breast. Very important to not smoke. The data shows that there's basically 2 periods in life where individuals will become smokers. And if we can avoid or get people through those 2 points in life without smoking, chances are very good they're never going to become a smoker. I'll try to make this interactive. Does anybody have an idea of when those 2 points are? It's got to be teens. That's right. It's actually younger than teens. It's middle school. So the first peak of smoking happens actually in middle school. So the data show that if you can get your kids or other young people in your life through middle school without smoking, chances are they'll make it through their teenage years without smoking. So a lot younger than you might think. That everyone thinks, well, when my kids are 14 and they're in high school, we'll start talking to them about all these things, but it's really got to start younger. It's got to start in like 3rd grade before they enter middle school. The next big hump happens actually in college. All right, so again, it's that age when they leave home and they're now exposed to the world and they want to try new things and there's peer pressure. So usually if you can get young people through middle school and through their first year of college without smoking, chances are they're going to be lifelong non-smokers. Alcohol use. So this surprises people. How many people knew that alcohol is implicated in increasing the risk of cancer? And so we know that there's some heart protective effects of cancer, that having some red wine might lead to decreased risks of heart attacks and improve people's cholesterol profile. But we actually know that as little as 1 drink per day can increase the risk of multiple cancers, including breast cancer, head and neck cancer, esophagus cancer, and liver cancer. So in my clinic, especially for women who've been diagnosed with breast cancer, what I encourage is for women to drink less than 3 servings of alcohol per week. And they'll say, well, my doctor told me it's good to have that glass of red wine to keep my heart healthy. And I'll say, well, there's also other medicines that can do that, such as aspirin and cholesterol-lowering drugs and keeping your blood pressure under control. But this data has been pretty compelling. It's valid data. And so we really want women to limit their alcohol consumption. And we also know that alcohol consumption in young ages, so basically the ages of between 16 and 25 for young women, a high alcohol exposure during that time also can lead to increased rates of breast cancer. So another conversation to have with your young people in terms of smoking prevention and also limiting alcohol intake. There's an idea that maybe folate consumption could reduce the increased risk of breast cancer caused by alcohol. And there was some data to suggest that the folate levels may help counteract the pro-cancer effect of alcohol. However, there was a study that was done in Europe which demonstrated that excess folic acid actually increased the numbers of lung cancers for patients in that study. So it's one of these things that if you have one study that shows something's beneficial, there's often opposing studies that show that that very supplement or that very thing is actually harmful. So it's a little bit tricky. So what is one to do is one has to just continue to try to live healthy lifestyle and try to decrease exposure to things that we know cause cancer. So sun exposure, so that goes back to the tanning bed. So we know that this is primarily increased risk for skin cancer, so melanoma, non-melanoma skin cancers. And it's also the cumulative sun exposure over years. And we saw this a lot more in people who are older because in the 70s and 80s, we weren't so conscious of this. So lots of people spend lots of times in the beach, lots of sun tanning. The younger generation is having kind of the opposite problem, which is vitamin D deficiency because of not enough sun exposure. So again, one of these things where it's the balancing act between the good and the bad. So weight and cancer. So there's really compelling data that shows that having a high body mass index, so being overweight, increases the risk of cancer. I don't know if you can see this very carefully, but in a study that basically looked at women who were either classified as overweight or obese, the number of cancers by age increased as the weight went up. So really the things that we want to do to limit our risk for cancer is to limit exposure to known carcinogens, such as ultraviolet radiation from tanning beds or from the sun. Limit exposure to carcinogens such as tobacco and alcohol. Maintain a healthy body mass index. So there's lots of websites that you can go to which have a body mass index calculator. This is from the National Heart, Lung, and Blood Institute. And basically you can put in your height and your weight and get a calculation of your body mass index and what your body mass index should be to be healthy. So basically a normal body mass index is between 18.5 and 24.9. If it's over 25 to 29, you're in the overweight category. Greater than 30, actually in the obese category. So you can play around with this and put your height in and then see what your weight should be so that you're at that healthy body mass index. Extra weight has been correlated with extra cancer risk. So each 5 kilogram per meter squared, so a meter squared is just kind of a measure of your total surface area of your body. So a taller person will have a higher meter squared than a shorter person. So each 5 kilogram increase in body mass index is associated with a 30 to 60% increased risk for these following cancers: endometrial cancer, cancer of the esophagus, and kidney cancer. And we're actually seeing increasing rates of esophagus cancer. And this is a very hard cancer to treat, and it's a very hard cancer to detect because the cancer is deep inside your body. It's in your esophagus, so it's not on something visible like the skin or like the cervix where they may be bleeding, or the breasts, which are very easily imaged. It's actually a cancer that's deep inside a part of your body that we don't look at regularly. And we're actually seeing rising rates of cancer of the esophagus, and we think that this also corresponds to the obesity that we're seeing in our country. Also, increased risk of colon cancer, pancreas cancer, and postmenopausal breast cancer. Less exercise, more cancer as well. So there was a study which looked at physical activity, and this was actually activity independent of weight loss. So these were people who were on exercise regimens, and they didn't necessarily lose weight, but they were more physically active than the control group. And what we found was that the physically active group had less cancers. So the group that was less physically active had a 30 to 40% increased risk of colon cancer, and we can also see increased risk of postmenopausal breast cancer and endometrial cancer. Now, what is that amount of physical activity you're supposed to have? You know, we always had this guideline of 10,000 steps. I read something recently in the news. I didn't read the study, but they actually said that we have to now go up to 15,000 steps a day. So these are hard things to do. That's probably about 3 to 4 miles of walking per day. So I think I have to go back. I was saying that it used to be like 3 days of vigorous exercise. I would say we're back up to 5 days of vigorous exercise. So 5 days of brisk aerobic exercise. So what does that mean? Everyone has pedometers and things on their devices and everything to follow and check. But it's really simple. You got to sweat. So if you're not sweating, it's not vigorous exercise. So you don't have to have all these fancy devices. Just check your heart rate, make sure you're getting to the target zone, make sure that you're sweating, and maintain that level for at least 40 to 50 minutes, 5 times a week. So exercise studies that showed that exercise reduces the risk for cancer were studies that showed that walking 6 or more hours per week at a moderate pace reduced the risk of death from colon cancer for 45%. So if I could give you a pill that said, if you take this pill, your risk of dying from colon cancer is going to be cut in half, I think many people would be lining up for that pill. However, as you know, most pills come with lots of side effects, right? So maybe that pill has the side effects of diarrhea, maybe that pill has, the side effect of hot sweats, but really exercise has very few adverse side effects. So we really recommend that everybody get up there and move and exercise. Women who are diagnosed with breast cancer that's hormone receptor positive, who walk just 3 hours per week, were 50% less likely to die from their disease. And I can guarantee you, if Pfizer had a drug that did this, they would be marketing it, it would be $1 billion industry, and it would unfortunately come with side effects, because we know that most medications have side effects, but walking really doesn't. There was a very interesting study that came out of UCSF, where they actually looked at men with prostate cancer who exercised, and they actually did a detailed molecular analysis, and they looked at the expression of 2 genes, which we know increases, if people have mutations in these genes, they have an increased risk of developing breast cancer or prostate cancer. And what they found was that in the men who exercised, these tumor suppressors, these good genes, these genes that prevent cancer, their expression got increased. So this was really exciting to me because it actually gave a molecular mechanism for how does exercise actually help prevent cancer. So not only does it make you lose weight and have less inflammation in your body, circulate the blood, but actually causes changes in the gene expression pathway. I want to switch to the concept of chemoprevention. So I was just, in keeping with my balanced talk, I was just talking about how medicines and drugs can cause lots of side effects, but now I want to talk about how medicines and drugs can be helpful. Because there are medicines that we can use, there are medicines that doctors can prescribe that can help prevent cancer. So when you think about the concept of preventing something, the idea is of chemoprevention. So chemoprevention is the use of a chemical substance, and it could either be natural or synthetic origin, to prevent, hamper, arrest, or reverse a disease process. So if you take a medicine to lower your cholesterol, you're actually doing chemoprevention. You're taking a medicine to prevent yourself from having heart disease, because one of the things that can increase your risk of heart disease is having high cholesterol. If you're on a medicine to lower your blood pressure, you're already doing chemoprevention. You're taking a medicine to lower your blood pressure, which will decrease your risk for stroke or heart disease. Now the supplements, if somebody's taking a vitamin or some other medicine because they want to help boost their immune system, they want to help decrease inflammation, all of that is chemoprevention. So we actually have two medicines that have been available for a long time. One is called tamoxifen and the other is called raloxifene. These are actually two medicines, if taken every day for 5 years, can decrease a woman's risk for developing breast cancer by 50%. So they're pretty good at doing what they're intended to do. So if a woman has a high risk for breast cancer based on her personal history or her family history, she can talk to her doctor about taking these medicines to prevent breast cancer. There are some side effects that are there. There's slight increased risk for stroke or blood clots, but if people take an aspirin a day, that risk is essentially down to zero, and a slight increased risk of developing endometrial cancer, but in the studies have shown that risk is less than 1%. So it's a balancing act. There's good data that says for individuals who are at high risk for developing colon cancer or multiple polyps based on their family history, if they take regular aspirin, they can reduce their risk for developing polyps by 50% as well. So if you do have a high risk of developing cancer based on your personal history, your family history, breast cancer or colon cancer, talk to your doctor about these things. What about diet? Can diet be chemoprevention? We just talked about that in terms of how maintaining a healthy body mass index is very important for decreasing your risk for cancer. Supplements such as vitamin D. So once we started telling everybody to stop getting exposed to the sun, we started realizing that many people were becoming deficient in vitamin D, which was impairing the normal function of their bones and their muscles. And there's data to suggest that people who have low vitamin D levels actually also have higher levels of different cancers. So we do think it's probably worthwhile, if there's a risk of cancer, to make sure your vitamin D level is checked and that's been supplemented appropriately. There's data that calcium may reduce the risk of colon cancer and prevent the recurrence of the polyps, which can grow into colon cancer. Selenium was thought to help reduce the risk of lung, colon, and prostate cancer. But there was a huge trial that was done evaluating selenium plus vitamin E, and it basically demonstrated increased risk for prostate cancer in men taking vitamin E alone. So you got to be careful, just because it's a vitamin and it's a supplement, it may not be so good. So I actually try to encourage most of my patients not to take a lot of extra vitamins and supplements unless they've been sort of specifically recommended to take those. Green tea is an antioxidant that can decrease oxidative damage in the body, and there's a lot of studies that show that green tea can prevent damage to DNA and promote repair of DNA. So I think it's a good supplement to take. I'm actually not a fan of green tea pills. I'm a fan of green tea because the tea is actually very complex, and when they've sort of analyzed it at a molecular level, there's dozens of active compounds in that green tea complex, and it's hard to know which ones are the active ones. So I think if you're well, having some supplements such as green tea is probably not a bad idea. Curcumin, this is the active component of turmeric, and turmeric is a spice which is often used in Indian cooking. It turns the food yellow. It's what makes curry yellow. And there's a lot of data that shows that exposure, curcumin or turmeric extract, to cancer cells in petri dishes can cause those cancer cells to die and can cause regression of tumors in animals. So I think that's something that's worth considering. A lot of people feel that they want to take natural substances, and I think it's good to have things in the most natural form that they can be, but I think it's not bad to have a pill as well. Here I told you, take the green tea, don't take the green tea pill, but when we know that a pill can can decrease symptoms and decrease diseases, I don't think it's a bad thing to do. So a little bit of spin, right? So I can talk about curcumin as turmeric, and I can sort of give you a picture like this, which shows like health and wellness, or I can give you a picture like this, which is actually the molecular structure of turmeric, and people will say, oh, I don't want to take that thing, I want to take that thing. But they're kind of the same, all right? And they can stimulate the immune system and inhibit inflammation. Important to know that what may be good in health could be bad in the disease. So when we're trying to treat people for cancer, especially with chemotherapy and radiation, our recommendation is that they stop supplement use. So many of my patients come to me and they say, well, I want to take this supplement because it's going to keep my immune system healthy, or it's going to help detox the bad effects of the chemotherapy. And I say, you can take that when you're done with treatment, but when you're on treatment, we actually don't want you to be taking lots of these medicines. So, but there were studies that were done which showed that when curcumin was given in addition to chemotherapy to cancer cells, actually decreased the efficacy of the chemotherapy. So we want to give you the treatment. When you're done with the treatment, then you can go on the supplements. Viruses actually can cause cancer, and we've known this for a while. And there's very compelling data of how vaccinations can prevent cancer. So hepatitis B, there's vaccines against hepatitis B, but exposure to hepatitis B and hepatitis B infection can lead to cirrhosis, which can lead to liver cancer. Currently, we're in a day and age where the majority of children at the time of birth are actually vaccinated for hepatitis B, but there is a group of individuals who, mainly older people, who were never vaccinated against hepatitis B. So we encourage everybody to get vaccinated. Hepatitis C has a cure now. So if you're positive for hepatitis C, that can be cured, but there's no cure for hepatitis B. HPV. So the human papillomavirus is a virus that's sexually transmitted or transmitted through oral and sexual routes or oral and sexual contact, and it's actually implicated in about 80% of cervical cancers. And we know that it's also relevant as a causative agent for many penile, anus, and oral cavity cancers. There's a vaccine that's available, and that vaccine has to be administered to young people. It has to be administered to individuals before they become sexually active, before they become exposed to HPV. So again, just like it's great to try to curtail smoking in middle schoolers, it's also important to think about getting vaccinated, young boys and girls, for vaccines to prevent HPV infection. When we think about cancers, you think about cancers as being random or sporadic or hereditary. So the majority of cancers are actually random. They happen because as the person ages, they get a mutation in one of their cells, which causes that cell to start growing and proliferating out of control. There are some families in which cancer runs in that family. So there'll be a family where grandma had a cancer, then mom had breast cancer, and now her daughter has breast cancer. So 3 generations are affected, and those individuals are affected under the age of 50. Remember I said that cancer is a disease of aging? So it's not uncommon to see breast cancer in 60 and 70-year-olds, but it's pretty uncommon to see breast cancer in 30 and 40-year-olds. So when we see a 30 or a 40-year-old with breast cancer, and she comes in and she says, well, yeah, my mom had breast cancer when she was 50, and my grandma had breast cancer, we start thinking, well, there's something going on in this family that's a hereditary component to their cancer. So about 70% of cancers are random or sporadic. 20% are familial, which means that they run in clusters in the family, but maybe we haven't identified the one gene. So there may be something more in that family that's contributing to the cancer in their family. And then about 10% are hereditary, which means that they can be passed on from parent to child. In breast cancer, which is almost a classic disease where we can look at sporadic and inherited breast cancers, The number one cause of hereditary breast cancers are mutations in two genes. One of them is called BRCA1 and the other one is called BRCA2. And what these genes do is they repair damaged DNA, which sort of makes sense. I told you that damaged DNA or mutations in DNA are actually one of the fundamental causes of cancer. So if you have a mutation in the gene that's supposed to repair DNA, it's going to increase the likelihood of having cancer. We get 2 copies of every gene in our body. So when a person has a sporadic cancer, they have 2 copies of each gene that are working. They may be exposed to something that increases their risk of developing cancer. So maybe in this case, this is a woman who had radiation to her breast to treat lymphoma when she was 20 years old. So she got a big dose of radiation to that breast. And what that did was that radiation caused a mutation in one of these BRCA genes. She still has a second functional gene that can substitute for the mutated gene. So another event has to happen for her to get a mutation in that second functional gene for her to develop the cancer, right? So there's 2 events that have to happen, and you may have a situation where you get that first event, but that second event never happens, or that event happens later in life. In an inherited cancer, what happens is the individual is born with one abnormal gene. So they're at a slight disadvantage because they only have one functional gene. Now they get that exposure and they lose their one functional gene, and so they're going to have cancer occurring more often and at younger ages. So the question is, what do I mean by lose a gene? So a gene is the DNA that is kind of the blueprint for the protein which carries out the function. So when you lose a gene, you don't necessarily lose the whole gene, but you lose the expression of that gene. So there's a mutation that that either causes the protein to not be formed at all, so that protein is not present in the cell, or a defective protein is made. All right. So when you lose the gene, you're kind of losing the normal gene. You're losing the presence of a normally functioning gene. And the reason why this is unique is because normally when you get a mutation in the cell, there are genes which repair that mutation. So if you get a mutation that happens, there are other components of the DNA repair mechanism that can fix this mutation and revert things back to this situation where both are normal. And in the case of BRCA, that protein, that gene, is actually part of DNA repair. So if you already have a deficiency in the ability of the cell to repair damaged DNA, it's going to accumulate more and more damaged DNA. That makes them more likely to develop breast cancers. So these are the genes. So these are actually pictures of our genes, our 23 pairs of chromosomes, and they've been colored so you can actually see them. And the BRCA2 and BRCA1 can be found on chromosome 13 and chromosome 17. And then there's also genes that are important in colon cancer. And one of the colon cancer syndrome is called Lynch syndrome. And it's important to know that there's hereditary colon cancer syndromes as well. And as we're getting more information about things, we're actually learning that there's hereditary kidney cancer syndromes. There are hereditary syndromes for endometrial cancer that's part of Lynch. There's hereditary cancer syndromes for different blood cancers as well. So, 10 years ago, we basically had a handful of genes that we knew that were responsible for hereditary cancer syndromes. Now we have knowledge of over 70. So the families that need to be tested, or the individuals that need to be tested, are those individuals who are in families where there's multiple generations affected, okay, right? So grandparents, parents, children, and multiple early onset cancers. So cancers for people in their 30s, 40s, and 50s, all right? And then certain specific ethnic groups. So for example, we know that these BRCA mutations are more common in individuals of Ashkenazi Jewish ancestry than non-Ashkenazi Jewish ancestry. So if a woman has breast cancer, even if she doesn't have family history, but she's of Ashkenazi Jewish ancestry, we actually will encourage genetic testing for her because these mutations are so much more common in that ethnic population. So if you want to think about what you can do to prevent cancer for yourself or prevent cancer for your loved ones, first is to stop smoking. We live in a state which is very anti-smoking. I think it's very hard to actually smoke in California now, except for in your own home. And I think there's a lot of motivation to try to curtail that, especially in young people. I like this because this is Joe Chemo, sort of made off of the Joe Camel. And his warning says that the Surgeon General warns that smoking is a frequent cause of wasted potential and fatal regret. And he's getting, here he is getting his chemotherapy. So I encourage everybody to talk to the middle schoolers in their life and, tell them about not even starting smoking. Limit alcohol intake to less than 3 servings per week. So 3, you can think of like a 4-ounce glass of wine, a glass of beer, a shot of hard liquor. But try to limit alcohol consumption to less than 3 servings per week. Limit excessive sun exposure. I had to go really far back to find this brown copper tone baby. This is the one I remember from when I was a kid. Maintain a healthy body mass index. So try to look more on this side of the spectrum than this side of the spectrum. And exercise. Prevent what you can. Get a vaccination. Encourage the young people in your life to get vaccinated. There's a lot of controversy about the HPV vaccine because HPV is sexually transmitted, so it's gotten caught up in a lot of politics of abstinence and discussion of sexually transmitted diseases. But you're really using that vaccine to prevent cancer, which is a pretty big thing. It's pretty important. Think about aspirin, think about medicines that can be helpful to prevent cancer. Do the right screening. So get the right screenings for cervical cancer. Know what's right for your particular age. And I was just talking to one of the gynecologists about this, and even though the data now says that if a woman's over the age of 65 and she's in a monogamous relationship, she doesn't need to be screened with a pap smear, she still needs to come in and get that annual physical exam. So women still need to get an annual pelvic exam. They need an annual breast exam. We were talking about how what's happened is that since these guidelines have gotten a little bit more stringent about not doing pap smears, many women have stopped going to their gynecologist, so they're not getting their breast exams or pelvic exams. So we still want you to go in for that once-a-year checkup. Breast cancer screening, women don't like to do this, but it's a great test. The amount of radiation that women are exposed to from a routine mammogram is very low. So she says, yes, I did have my mammogram today. Why do you ask? I understand that it's uncomfortable, it can take some Tylenol, but it's still really the most effective test to screen for breast cancer. Lung cancer screening, so something that's not on many people's radar, but important to know. A low-dose CT scan for those in the age group should consider getting a low-dose CT scan to screen for lung cancer. So if you fit into this category, I encourage everybody to go talk to their doctor and see, what do you think about me getting a CT scan to screen for lung cancer? And we do them right here at Washington Hospital. Your insurance will cover the cost of them as well. And again, lung cancer is one of those cancers that's hard to detect at an early stage because it's deep inside of your body, and a tumor can grow to be quite a large size before it becomes symptomatic. So here we go, genetic testing, if indicated. You need to know the genetic history and the family history on both sides of the family. So these cancer genes can be passed on from the father's side as well as the mother's side. So I have patients who come to me and they say, oh, I don't need genetic testing because I only have sons and I had breast cancer. But that's not true. If her breast cancer was hereditary, if it was genetic, she can pass that gene on to her sons just as well as to daughters. So just because it's breast cancer doesn't mean that we ignore the male side of the family. Plus, men can get breast cancer as well. 2% of all cancers are actually male breast cancers, all right? And men with a mutation in BRCA1 or BRCA2 are at increased risk for developing breast cancer, prostate cancer, and we also know that with BRCA2 mutations, there's increased risk of pancreas cancers too. We've made a lot of advances in cancer treatment in the beginning, which was, maybe 10 years ago. We sort of had a simple model with very simple cartoons. I'm not going to go through all of these. Then we moved into a slightly more complex idea of cancer. And now we have something that looks like this. And this is just one cell. So these are all the pathways that are known to be involved in cancer just in one cell. And what this isn't even looking at is the complexity of where does that cancer live inside the body. And we now know that there's a huge impact of a person's immune system on cancer. So the strength of the immune system will really be very important in determining how a person's cancer may actually grow out of control. And we're now using drugs, we're actually using drugs to target the immune system and to stimulate the immune system to help fight cancer. So you're seeing a situation where what a cancer cell can do is it can actually create a wall, it can create a barrier around itself, making it invisible to the immune system. So the immune system cells are there, they're right present next to the tumor cell, but the tumor cell itself has put up this shield. I kind of often think of it like Star Trek. I'm a little bit of a geek, right? So you think of Star Trek where they would put up that, it was the Romulans, right? They would make that invisibility cloak around their ship so you couldn't see it. So they'd be right there, but they couldn't attack them because they couldn't see it. So the drugs that we're using now, immunotherapy, I'm sure you've heard a lot about immunotherapy. What immunotherapy does is it removes this shield. It removes that cloak between the cancer cell and the immune system. We are also working on things to stimulate the immune system. So now the immune system can go and attack that cancer cell. So this is basically a slide showing an individual who had a tumor here before their treatment. After one cycle of treatment, after 8 weeks of treatment, they actually saw swelling. It looked like the cancer was growing. But then after 16 weeks, we found that the cancer actually shrunk away. And what we now know is the swelling that happens is actually from the immune system invading into that tumor and causing inflammation. So just like when you get a cut, it becomes swollen and red and angry. This is exactly what's happening to the cancer cells. That tumor, the immune system is coming into that tumor and attacking all those cancer cells, causing it to look bigger on the CT scan, but in actuality, several weeks later, it's gone. So it's just more in terms of the immune system. We're also now trying to use an individual's own immune system to fight cancer. This is a very exciting therapy that's still in experimental stages, where an individual who has cancer, their own immune system cells are removed from their body. The immune system cells live in the blood. So blood is removed and those immune system T cells are removed from the body, and then they're transformed in petri dishes and activated and then put back into the person. And we find that these engineered T cells can now go in and attack the cancer. And we can actually, I'm saying we like I'm doing it, but the scientists and the individuals who are developing these drugs can actually start engineering them in a way that they recognize an individual's specific lung cancer or lymphoma or breast cancer. So it's really, really exciting. And what's exciting about these kind of treatments is they're a lot more targeted than our normal chemotherapy. So when we give chemotherapy for breast cancer, that's not targeted therapy, it's attacking normal cells and healthy cells as well as the cancer cells. So our newer treatments are moving towards, we use the word precision medicine, so becoming more precise to attack specifically the cancer cells and then help a person's own immune system to fight that cancer cell. So it kind of goes back to what I was talking about, the supplements, right? So all of the things that people have talked about for many years about maintaining a healthy immune system is very relevant for preventing cancer and for treating cancer. The challenge has been, historically, doctors and scientists have not known exactly what to do to capture that. And now we have a better idea of how to do that. So I think that there are things that can help keep your immune system healthy. Sleep and exercise, probably more than any supplement out there, more than you can drink 8 cups of green tea a day, but it won't help as much as going out and exercising for an hour and getting a full night's sleep. So this is my prescription for cancer prevention. So basically limit exposure to known carcinogens, maintain a healthy body mass index. So go on your favorite search engine, type in body mass index calculator, put in your height, put in your weight, and see where you are. and do this for your family members as well. Vaccinate. Vaccinations against HPV and hepatitis B, think of them as not preventing sexually transmitted diseases, but as preventing cancer. And then chemoprevention if you're at high risk. So take the medicines that are known to help prevent cancer. Thank you.